Hello, I'm Eric Logothetis. I'm here with Uza Hamad and Abanayanes Radassan, and today we're going to discuss the second pillar, beneficence. So, Abanayan, what is beneficence?
That's a good question, Eric. So, beneficence, what it actually means is that it means that all medical practitioners have a duty to prioritize certain courses of action for the patient's health. But however, in reality, when we're actually practicing beneficence, we also need to de-promote other courses of action if there's better options available. But we shouldn't think of it too simply because it's quite complicated. Thinking of it too simply can be quite problematic. There's quite a few aspects to it as well. Would you like to talk about those?
Yeah, so there are quite a few aspects that have been said. So whether or not one of the options for treatment will resolve the patient's medical problem, is it proportionate to the scale of the medical problem? Is the option compatible with the patient's circumstances? So if they have any injuries, that does not allow them to have certain treatments. And is the option treatment, and is the outcome of the treatment in line with the patient's expectations? So in regards to amputations, the patient may not want to be disabled for life. Also, beneficence basically comes down to two main things. So thoroughly considering every treatment pathway, and does the best course of action align with the patient's ideal outcome? So, Eric, do you want to talk about what holistic care is?
Yeah, holistic care is quite controversial, but yeah, it comes down to treating entire persons, what they believe in as well as their medical their aspect of their illness. So it combines traditional medicine as well as complementary medicine. And complementary medicine doesn't scientifically work. So it would include things like acupuncture. This may be better for some people, and be just because it aligns with what they believe is right for them. So, for example, there have been people who wanted to treat their cancer with chemotherapy and acupuncture. It doesn't really have any effect, that acupuncture. So, it does not do anything negative. So, I think it is quite good if it helps a person's mental well-being as well. What do you guys think on that?
Yeah, I
I
think
think,
that's... Oh, you go.
yeah, I think holistic care is very important for, was it emotional, spiritual, physical well-being? Because you want to make sure that the patient gets the best care possible. It's not just about them getting better, it's to make sure that their mental state is also getting better.
Yeah,
Yeah, I think that does have quite a cultural impact as well. People might be
mm.
comforted if they're
Can I,
treated with
can I just ask, what is acupuncture?
Acupuncture, it sort of includes things like putting needles, I don't know, needles into people specific places. There's specialized people who do that, and like using cups that would sort of draw the blood closer to the skin by sucking on the that skin surface there.
Hmm.
Okay.
Leading on to that, something quite similar to holistic care is patient-centered care. And it's quite similar in the sense that it gives both the patient and the family a say in the decision-making process when planning care and treatment. This does link to autonomy, which we discussed in our first episode. But it also respects the patient's individual preferences. So what the patient wants as well, you need to consider that, especially if the patient's conscious and makes decisions. And it also allows patients to protest against treatments that are going to happen to them as well, which is quite important.
Because they have to feel comfortable with what is going on to them, really.
Yeah, it is their right to decide whether or not they want to have that treatment.
So, would amputations be part of patient-centered care? So, if a patient was having an amputation, so would the parents and the patient both have a say in whether or not they get the amputation, even if it's life-threatening? Or
Yes, they would have a say, but if it's life-threatening, it is up to the doctor whether or not the patient should get this treatment. Because if they feel that the amputation would save their life, then they would have to make that decision and go against the parent and the patient's will.
So ultimately, it comes down to the doctor.
It does come down to the doctor and their decision, their judgment. So leading on from that, we can also talk about the implications of amputation and what effect that has on the patient.
Yeah, so an amputation is a surgical removal of the part of the body, such as an arm or a leg. So an amputation might be needed if you have a severe infection in your limb, or if your limb has been affected by gangrene. So gangrene is a serious condition where a loss of blood supply causes body tissue to die. It can affect any part of the body, but normally only affects the tips of your toes, feet, and fingers and hands. An amputation may also be needed if there's serious trauma to your limb, such as a crush or blast wound, or if your limb is deformed and has limited movement and function. So to treat amputations, some people get prosthetic limbs. So prosthetic limbs are not suitable for everyone who's had an amputation because you need an extensive course of rehabilitation and physiotherapy, and that might not be suitable for some patients who may not want to do it, or if they may not be capable of going under such extensive physiotherapy. But if you're able to have a prosthetic limb, the type of limb that's recommended for you will depend on a number of factors, such as the type of amputation you had, the amount of muscle strength in the remaining section of the limb, your general health, tasks the prosthetic limb will be expected to perform, whether you want the limb to look as real as possible or you're more concerned with function. Okay.
Just while we're on the topic of amputations, are there any mental implications that amputees have? Because it would be quite traumatic having an entire limb removed. So how would that factor into holistic care? Because
I think mental, it needs to be considered very thoroughly, and it should come down to what is best for the patient. So it does really link to beneficence in the sense that all other procedures and treatments should be considered first, because obviously getting amputation would be sort of a last resort, because there is a risk of serious infection after the amputation.
Yeah,
but
I agree.
Patients should be really first.
There are actually like many physiological and mental complications with amputation. So some of the physical ones could be heart problems such as a heart attack, deep vein thrombosis, which is a blood clot in the vein, normally in the leg, a slow wound healing and wound infection, pneumonia, and stump and phantom limb pain. So some of the physiological impacts also include coping with the loss of sensation from your amputated limb, coping with the loss of function from your amputated limb, and your sense of body image. So this is physiological, but also somewhat mental, because when you have an amputated limb, you might think that people think less of you now. So people's perception of you in their mind might change, or you might think that, and it might not necessarily change. And common emotions include depression, anxiety, denial, so refusing to accept that they need to make changes, like physiotherapy to adapt to their new lifestyle, grief, and suicidal thoughts. Many people who've actually had amputations are diagnosed with PTSD. This is like particularly for members of the armed forces, because they've been through many wars, and those are really mentally damaging.
So you said many.
Oh yeah.
Yeah, go on.
Oh, there are many help and support hotlines, such as the Limbless Association, Douglas Bader Foundation, Steel Bones, and Amputation Foundation. These foundations help you adjust to life after getting an amputation.
Yeah, and also... Oh, yeah.
Yeah, go ahead.
So, and it also must be pretty frustrating. I mean, losing an entire limb, that is life-changing. It's a life-changing injury. So you're going to have to consider how that patient's going to live his life after this amputation. You have to evaluate whether the injury is life-threatening or non-life-threatening, and if there's an alternative. Because there's going to be a massive limitation to their physical movement as well. So,
I think that once they get it, it feels really horrible. So soon after the amputation done, they have like devastating and frightening feelings or something similar. But after a while, I believe that they get used to it, and the quality of life doesn't decrease that much, except for certain daily functions that they can't do themselves. But other than that, the quality of life isn't changed that much. So I don't believe that it's a huge change.
But would it not take away from their individuality, as in their independence as a person?
So, what do you think? What do you think a doctor should do if a patient refuses physiotherapy, but they have the capacity to take the physiotherapy and rehabilitation courses?
Yeah, I think it's quite a big task for someone to gain that. Even though they've got the physical ability to do that physiotherapy, it's quite a big task to get the mental will and desire to do that, to achieve that better outcome. But the doctor really should be able to convey the best idea to the patient. I think it comes down to them being able to explain what is best for the patient to the patient, focusing more on what is best for the patient, really. Even though the patient should decide in the end, I think all treatment should be considered by the doctor beforehand, and he should really try to convey the best way to the patient.
So, would you bring this down to beneficence as a doctor promoting the best course of action for the patient?
Yeah, beneficence really shows in this one.
What about you, Aberdeen?
Well, I think the conveying the problem to the patient well is also pretty important. It comes down to beneficence as well, because the patient has to understand their situation, because they might not understand the severity of their injury, even if it's not life-threatening. It could be life-changing, which is still pretty serious. So if the patient doesn't understand that, they might make the wrong decision. So the doctor's ability to communicate is also vital here.
So you're saying that it's the ability of the doctor to convey information to the patient about how his life would be after rehabilitation, physiotherapy, and the improved quality of life you could achieve.
Yep, that would also come into play. The doctor has to give a realistic picture to the patient of how their life will change, if it will change.
Yeah, because you don't want to give false hope in that scenario.
Yeah, but you also don't want to make it seem too bad either. You don't want to make it seem like it's the end of the world for them. You got to give them hope as well, but not too much hope, as you mentioned.
Yeah. So, Eric, what should be done if a patient refuses treatment?
Well, really, it depends whether that treatment is life-threatening or not. Obviously, the doctor should do, unless there are serious circumstances, for example, when there's DNRs involved, they should really try to save the patient in those life-threatening scenarios. However, it comes down to whether or not that, it links to autonomy a bit, but it comes down to really whether or not the patient understands what's going to happen in those non-life-threatening scenarios. If they're competent really enough to, if the doctors explained it and conveyed that situation well enough to the patient, I think that choice from the patient to refuse that treatment should be respected.
Yeah, so in the General Medical Council's ethical guidance for doctors, bullet point 24 says that you must respect a competent patient's decision to refuse an investigation or treatment, even if you think their decision is wrong or irrational. You may advise the patient of your clinical opinion, but you must not pressure on them to accept your advice. You must not put pressure on them to accept your advice. You must be careful that your words and actions do not imply judgment of the patient or their beliefs and values. So,
I think that's quite fair.
Yeah, that is fair, but it's also important for the doctor to give an unbiased opinion as well of the patient's condition. You shouldn't, of course, the doctor shouldn't bring in his own opinion into the...
No, the doctor can give his clinical opinion, I think, depending on... Since the doctor knows best of what the patient's current condition is, and he knows... He has more knowledge, so he probably knows what's best for the patient.
So the doctor can bring in his clinical opinion.
He can say his opinion, but he can't pressure the patient to accept his advice.
Okay, that makes sense.
Yeah, I think a good way of coming about that is really doctor conveying his opinion, what is best medically, also coming in with different treatments and scenarios for the patient to choose what's to be done to them.
Yep, and he should outline the pros and cons of each and let the patient
Yeah.
decide, because it's the patient's choice
Yeah.
at the end of the day.
Yeah.
This also sort of links in with autonomy, so the patient's mental capacity. If they might not have enough mental capacity to make a decision, then I think, on bullet point 26 of the ethical guide, it says that both parents refuse treatments on the grounds of religious and moral beliefs. You must discuss their concerns and look for treatment options that will accommodate their beliefs. So that's if the child is under 16.
But what if the patient, let's say they just had an accident, and they're not in the best of shape, they're not in the right state of mind. Would you still allow that patient to make that decision, that important of a decision, to have the treatment, if they're not in the right state of mind?
I mean,
Cloud of
there's
judgment.
certain tests that doctors do to make sure that a person is not lacking capacity. So I believe that if you carry out these tests, and if they fail these tests, that means they can't make the decision for themselves. And if there's no family member nearby for like any life-threatening injuries that the man may have or patient may have, then I believe it falls down to the doctor to act in the best interest of the patient. So beneficence.
Yeah,
Yeah.
that does make
Yeah. It
sense.
comes down to beneficence quite a lot here.
Yeah, it all links back to it. So, let's move on to a case study. So there's an 8-year-old child who's been admitted to a hospital, and they've got a significant open fracture on their left leg. The limb is deformed with significant bleeding, and the patient's extremely distressed, as you might imagine. The parents are demanding immediate action to be taken. So what would you do in this situation, linking back to beneficence?
So you said they have a significant open fracture to the left leg, right?
Yeah.
The limb is deformed with significant bleeding and patient is extremely distressed.
And again,
So-
this patient is 8 years old, so under the age of 16 that you mentioned.
So if they're that small with that significant of a fracture, if their limb is deformed with significant bleeding, then
This does
It
seem
might-
like...
it might have to be amputated if it's a life-threatening injury, or not even if it's not life-threatening. If it gets infected, then it could be life-threatening.
Yes, but shouldn't the doctors try and find a way to remedy the injury before they go to more extreme measures like amputation?
Yeah, amputation is really the last case scenario,
Yeah.
as we said earlier, because it can bring about a lot of serious other implications with it. For example, infections can start from that. Obviously, this is an 8-year-old.
But even if it's left
Yeah.
without being amputated, it could still start an infection. Instead, it's bleeding a lot from the left leg, so that could still
there are
cause an
other
infection.
treatments that can be offered by the doctor that may even be better in this scenario. It really depends on how serious the condition is, though. For example, you could have less drastic surgeries, and that may still even come out with the same. May remove may save the patient without taking away such an important thing like a limb to him.
Yeah, and I think this is especially important since it's an 8-year-old. They've still got so much of their life ahead of them. And if they have such a life-changing injury right now, then it's going to affect their quality of life for a much longer period. And their development as a person. So I think the focus of treatment for this situation should be on avoiding extreme measures like amputation. Amputation, of course, if there's no other way and you have to amputate the limb, then nothing can be done. But I think there should be more of a focus on alternative treatments, in this case specifically.
Providing them to the parents for them to choose.
Yeah. But
I completely agree,
Yeah.
but yeah, so if there was an amputation, there'd have to be some severe complications, so it's better to leave that for last and weigh up all the other options carefully. So as I said before, the beneficence is weighing up all the options carefully and ensuring that the outcome is in line with the patient's ideal outcome. So here, it seems that since the boy lacks capacity, the parents' ideal outcome would be that the boy keeps his leg. Boy would probably also want to keep his leg.
Mm-hmm.
So amputation may not be the best case. Yeah, so as Eric said, using certain products to prevent the injury or to reduce the injury and treat it over time would be better.
Just expanding on this situation. Let's say an infection did develop and the patient's limb wasn't able to be saved, but the parents were still insisting that the child kept the leg or the arm. But it was life-threatening. If they kept the arm, then the infection would spread and it would be life-threatening. What would you do then? Would you go against the parents' wishes and amputate?
I think in that scenario, you would have to perform the tests to check if the parents have competency. Because obviously, if they don't, then the doctor would get to choose that outcome there.
Yeah.
Like as I said in the General Medical Council thing, make sure you can state your clinical opinion, but you can't go against the wishes of the parent.
Yeah.
You can't go against the wishes of those who have capacity to make the decision.
Yeah. In this case, just losing a leg is better than dying. So.
Mm-hmm.
Even if the
What is
quality
the
of life may
decision?
be reduced.
Yeah. Since there's no other choice. Yep. I think that brings us to the end of our second episode.
Yeah, so thank you for listening on the talk about beneficence. Come back for our next episode where we will be talking about non-maleficence. Thank you.
Thank you.
Thank you.